Greetings to those of you who have already successfully connected. We have over 30 folks trying to log in now, and some are still connecting to audio. So we'll give you all another 30 seconds or minute or so. Okay, well, it is 2 o'clock. Denise, give me a thumbs up if you think we're ready to roll. All right, thanks. Excellent. Welcome, everybody. My name is Sean Suhosky. I'm the chair of Small Town Administrators of Massachusetts. It's good to see you all. Most of you know that. Some of you are joining us from finance offices as well, so we welcome you. And it's good to see everybody. And one of the fun things about these Focus 55 sessions, I guess it's fun, is that we keep it to 55 minutes. So we can get you in and out and hopefully share a lot of great information. We have a terrific panel today. We're going to talk about the generally about opioid lawsuits and the settlements, how that impacts municipalities, what we might be able to do with those funds for the good, what we want to stay away from, certain reporting aspects, and how do we account for them? You know, how do we take those funds into the Treasury? Where do we park them? Where do we report them? And then how do they have to be appropriated? So we all know, before I go further, we are being recorded. And after the panelists present, we'll have a Q&A to follow. And I'd ask that you use the Q&A feature, type in your questions. Denise will help moderate that, or will moderate it with me, Denise. We'll figure it out. And hope to get to all your questions. So without further ado, I guess I will introduce our panelists. And we have with us Deb Wagner, who is now Director of Accounts in the Division of Local Services at Mass DOR. We're also going to hear from Sandra Walitsky. She's an attorney with the Attorney General's Office and is actually the Deputy Chief of the Healthcare Division. And we have Attorney Mark Rich from KP Law. Many of you may know through your travails through municipal law, and Mark has been town council here and there to various communities across the Commonwealth, working on a whole variety of matters. So we're very thankful for your time of our panelists. And we do have an order of events. And when we were logging in before we started, some of my colleagues who came on earlier in the panelists saw me moving around because I can't find my list of the order of show that we wrote up. But I'm going to take a wild stab at it and say, I believe we're going to hear from Sandra Walitsky, our Assistant Attorney General, first to give us the overview, why we're even here having these conversations. And then we'll hear on the financial piece and municipal concerns and pitfalls before going to the Q&A. So I'm going to stop talking and we're going to turn this over to Attorney Sandra Walitsky, and thank you for joining us.
Thank you so much, Sean. Thank you for the invitation, and thank you all for your interest in this important topic. Denise, are you able to pull up my slides?
Yes.
Thank you so much.
Okay, can you see that?
I do. Is it possible to go into presentation mode just to make them full screen? I know some of the slides have a bit of text. Perfect, perfect. Thank you so much, Denise.
You're welcome.
So I'm Sandy Walitsky. As Sean said, I'm the Deputy Chief of the Healthcare Division here at the Attorney General's Office. Next slide, please. So just a quick overview of the topics I want to cover with you all this afternoon. I'll give, as promised, a little bit of background on the Attorney General's statewide opioid settlements, including information about a pair of finalized statewide settlements through which money is already flowing to the state and cities and towns, as well as 5 new statewide settlements. I'm going to talk a little bit about the sign-on process for municipalities who seek to join these new statewide settlements. And then I'll talk about municipal abatement funds and the state subdivision agreement that we have in place about how those are to be distributed and used. Next slide, please. All right, so apologies for the size of this one. To orient us for this conversation, I just wanted to provide quickly at the very highest level kind of the key findings from our investigations into the opioid space. So we found that opioid manufacturers used unfair and deceptive sales tactics to aggressively promote prescription opioids. Opioid distributors failed to implement adequate suspicious order monitoring systems, ignored red flags, and shipped thousands of suspicious orders to pharmacies across the state. And pharmacies across the state violated their responsibilities by dispensing opioid prescriptions without sufficient regard for their legitimacy. And I think we all know the resulting tragedy here. This misconduct enabled and perpetuated vast increases in opioid overdispensing and diversion, and multiplied the toll of substance use disorder, overdose, and death that we've seen in the Commonwealth. The data here is a little bit old, but from 2009 through 2021, over 18,000 Massachusetts residents died of opioid-related overdoses, and over 12,000 of those filled opioid prescriptions written by Massachusetts prescribers. Next slide, please. So far, we have finalized statewide opioid settlements with 3 of the nation's largest opioid distributors and with the opioid manufacturer Johnson & Johnson. The way that these settlements are structured, the more cities and towns that sign on, the more money the state as a whole can recover under the agreements. So in Massachusetts, we have very robust participation in this pair of settlements with the distributors and J&J. So Massachusetts is going to recover the maximum abatement funds available under these agreements, over $525 million over a period of years. Throughout my slide deck, when you see things in yellow, it's because it's a hyperlink to more information on our website or in other places. I'll make sure that a copy of these slides are sent around afterwards. But you can see here, participating is one of these hyperlinks, and it will lead to a list of all of the Massachusetts subdivisions that have signed on to the distributors and J&J settlements. As of earlier, well, not this month anymore, happy March. As of mid-February 2023, over $42 million has already been paid out to Massachusetts cities and towns from the distributors and J&J settlements. The Attorney General's office has reached 5 new proposed settlements in principle with the entities listed on this screen: pharmacies, CVS, Walgreens, and Walmart, and manufacturers Allergan and Teva. The total amount of abatement money that is likely to flow into Massachusetts as a result of these 5 settlements is over $420 million. We are currently in the municipal sign-on window for these 5 new settlements. And that's actually where I'll focus the remainder of my presentation. So in order to receive payments under these settlements with CVS, Walgreens, Walmart, Allergan, and Teva, Massachusetts cities and towns have to sign on, have to submit participation forms by April 18th, 2023. And I'm going to explain a little bit more about what's involved with that. So municipalities should have received already digital participation forms and instructions for what to do with those forms from Rubris, the settlement administrator, in early February. As I mentioned, the deadline, March 18th, 2023, is the date by which municipalities have to make a decision as to whether they will participate in these 5 new settlements and receive payments under these settlements. Of course, municipalities that have retained attorneys to file opioid litigation should consult their attorneys about how to proceed. Next slide, please. Municipalities need to sign and return a participation form for each settlement in which they want to participate. The only nuance there is that the Allergan and Teva settlements have a shared participation form, whereas the other 3 settlements, CVS, Walgreens, and Walmart, each have their own participation form. So it is a total of 4 participation forms in order for a municipality to join all 5 of these proposed settlements. Just to be crystal clear, forms submitted in connection with prior settlements, like the settlements I mentioned with the distributors and Johnson & Johnson, are not applicable to the 5 new settlements. So just because a city or town has already joined the statewide opioid settlement with, for example, Johnson & Johnson, you still need to submit a new set of participation forms to join each of the new proposed settlements. Prompt sign-on from our cities and towns will ensure that Massachusetts and its municipalities receive the maximum amount of abatement funds from these settlements. Next slide, please. So a lot of yellow here because this slide is really loaded with information. Our state subdivision agreement specifies how the funds from statewide opioid settlements can be used and how they will be allocated within our state. So 40% of the recoveries from statewide opioid settlements will go directly to municipalities to spend on approved programs and strategies. And I'll describe a little bit more what that means. And 60% go to the statewide opioid recovery and remediation fund. So approved uses under the state subdivision agreement include opioid use disorder treatment, support for people in treatment and recovery, connections to care, harm reduction, addressing the needs of criminal justice involved persons, support for pregnant and parenting women and their families, including addressing neonatal abstinence syndrome, prevention of misuse of opioids, and implementation of prevention education. Our state subdivision agreement reflects a shared commitment from the Commonwealth and our municipalities that 100% of abatement funds recovered from statewide opioid settlements should go to supplement and strengthen resources for prevention, harm reduction, treatment, and recovery. The state subdivision agreement also requires annual reporting to EOHHS by certain municipalities. So starting in July of this year, municipalities that receive $35,000 or more in a fiscal year, individually or pooled, will need to report on their expenditures on approved programs and strategies, as well as efforts to incorporate input from experts and people with lived experience, efforts to address disparities and improve health equity, and also to leverage existing programs and services. There's also reporting on successes, lessons learned, and areas for further progress. There's a draft reporting form that's posted online to give you a sense of what to expect when our first reporting cycle goes live this summer. So you can click through when you get these slides to take a look at that draft annual municipal reporting form. Finally, the state subdivision agreement permits municipalities to pool funds in order to leverage and maximize the impact of these settlement dollars. Next slide, please. So here is just a quick overview of some highlights on the Attorney General's Office website that I think may be of interest. First, we've developed a frequently asked questions site with information on the sign-on process for the new settlements, as well as detailed financial information, including numbers 2 and 3 here on this list, charts that reflect the maximum estimated annual distributions to municipalities for each of the 5 new proposed settlements, as well as information on what to expect going forward in terms of payments coming from the settlements with distributors and J&J. Last slide, please. Okay, and probably the most important of my slides is this one. It has the email address for the Massachusetts AGO opioid settlement team. Please don't hesitate to save this email address and reach out to me and my colleagues. We are happy to take questions about the proposed settlements and the sign-on process, about the finalized settlements, any questions that we may need to forward to our colleagues over at DOR or OIG, whatever it is, we'll help you find the answer or a person who knows the answer. And we monitor this inbox really closely. So please don't hesitate to reach out with any questions. Thank you so much for having me here today.
Thank you so much, Sandra. That was a great presentation, and we appreciate as well that you'll make the slides available, and with those hyperlinks, it will really help us out as both the administrators and our finance teams dig into that. We're gonna, again, we'll use the Q&A function at the end of the presentations, and so keep your Q&A coming, and meantime, we're gonna figure out, now that we've got those settlements, Deb, and the monies are coming in, now what do we do?
Well, let me share my screen with you, and we'll talk about that. This I'm sure will make me the most popular person in the room. So the way I'm going to facilitate my discussion of handling the accounting treatment for these funds is by referring to our FAQs that were published in our July of 22 issue of City and Town. And hopefully everybody can see my screen. And so like Sandy's presentation, there are a few hyperlinks, and I'll also share these with STAM so that they can be distributed. The slides can be distributed, and these are live, links to further information. So can a municipality that anticipates receiving settlement funds from the recent opioid settlements set up a special revenue account to record them? Unfortunately, the answer to that is no at this time. One of the overarching principles of municipal finance law is all revenue is general fund revenue according to Chapter 44, Section 53 of the general laws. And at present, there's no special law that provides an exception for these settlement proceeds. So accordingly, statewide opioid settlement funds received by a municipality belong to its general fund. All of that being said, the following FAQs are going to provide for you a little overview of kind of how you get around that particular requirement. Is the legislature considering an amendment to create an exception to general law, Chapter 44, Section 53 for statewide opioid settlement funds paid to municipalities? So they were, and then they weren't, and now they are again. And we're hopeful that in a supplemental budget that comes out, hopefully in the near future, that an amendment to Chapter 44, Section 53 will be passed. And what that does is allows for two things. It's under a circumstance where there is money that is, we consider one-time revenue, that it's being distributed to multiple communities. And even though the opioid funds have multiple distributions, we kind of consider it a one-time event. And so, but after that, there would be two criteria. If the funds have a purpose that is singular, so for example, when the Veterans COLA funds were distributed at the end of fiscal year 22, those were only for use for a single purpose, whereas opioid funds, although they generally can be used for one purpose, I mean, really there's multiple sub-purposes, under that they can be used, as Sandy described at the end of her presentation. So this amendment would allow the Director of Accounts to make a determination that the funds can be treated differently than just being placed in the general fund and closed to free cash. So we're hopeful that that gets passed this time. Can a municipality that received opioid settlement proceeds prior to June 30th of 22 make an appropriation directly from those proceeds for their intended purpose at a meeting of the legislative body? So if you got opioid funds prior to June 30th of 22 and you've had your free cash certified, those revenues should have been closed to the general fund and become part of free cash certified by the Director of Accounts. And from that free cash certification, you can make an appropriation. You know that X amount of opioid proceeds were closed to your general fund. So you know that those revenues are sitting in your free cash certification. So you know that you could make an appropriation from free cash for the related opioid purpose. I want to stress that the way the accounting for these funds work does not absolve any requirement to use them for their intended purpose. It's very important that everyone understand that even though they're certified as part of free cash, they must still be used for their intended purpose. And then, I do want to caution that although free cash can be used for any lawful purpose, there could be an issue where town meeting does not vote that purpose. But again, it does not remove the requirement of the community to use the funds for the purpose that they're intended. How can a municipality that receives opioid settlement proceeds after July 1st of 22 use those funds in 23? So before you set your 23 tax rate, you could have made an appropriation from the tax levy for an opioid purpose. And then on page 3 of the recap, you would have estimated an offsetting amount of opioid revenue to reduce the effect on the tax rate. That would have been on page 3 under local receipts, miscellaneous non-recurring. This same process, despite that this references 23, also is in effect for fiscal year 24, because you're going to be getting annual installments of these funds. So if you get opioid funds in fiscal 24 before you set your tax rate, then you could make an appropriation from the levy and estimate an offsetting amount on page 3 of the recap. And if you didn't do that, FAQ number 5 indicates that what you can do if you make the request and receive the funds prior to March 31st of 23, if you've had your fiscal year 22 free cash certified, you can request a free cash update for those opioid funds that you've received in fiscal 23. We've been getting a lot of requests for free cash updates so that at your Springtown meeting, you could appropriate from your free cash for those fiscal year 23 opioid receipts. Can a municipality vote to dedicate to a special purpose stabilization fund some or all of the opioid settlements it receives? And the answer to that is yes, but I want to be clear. What we're saying is not that you can take a vote. I move to appropriate $25,000 from opioid funds to a special purpose stabilization fund, an opioid special purpose stabilization fund. What you would be doing is taking a vote of your legislative body to dedicate the revenues to the special purpose stabilization fund. So it would happen automatically when the funds come into the town. You wouldn't even need to take a vote after that vote to dedicate the revenue. your accountant will just journalize the funds to the Special Purpose Stabilization Fund. IGR 17-20 provides more information on how that establishment of the stabilization fund and the dedication of revenue happened. Must amounts appropriated from free cash for opioid remediation purposes be closed to the general fund if they are not expended prior to the next fiscal year? No, this is just like voting a special article at your town meeting from free cash. So you would make an appropriation from your free cash for whatever the opioid purpose is that you specify. And until that purpose is fulfilled, you would carry that reservation of fund balance reserve for special article on the balance sheet until that purpose is fulfilled. You know, we understand at the Department of Revenue, and we've been fielding many questions about the accounting treatment of these funds. I think we, as much as all of you, hope that the legislature approves the wording to amend Chapter 44, Section 53. This isn't going to be the last time a special amount of money arrives on the doorstep of cities and towns. Could be for many different purposes. And we're concerned about the ability to make it easy and to make it easier to fulfill the purpose for which the town, the funds were being distributed and that you want to expend them. So like Sandy mentioned, and I'll drop my email in the chat, please feel free to reach out, call me or email me. I'll drop my email in the chat, but please reach out if you have any questions, and we're happy to help. Thank you.
Thanks so much, Deb. That was a really condensed, but a great wealth of information there. We also appreciate that you have material with hyperlinks. We got a hyper crew, you know, in this STAM group, so we're excited about that, believe it or not. We have one more presentation before we get to the Q&A, and that's where you'll type your questions into the Q&A, and Denise and I will kind of go back and forth moderating that. But first, we're going to hear from a municipal town council through Mark Rich, who's with KP Law. And maybe, Mark, whatever it is you want to share with us, and maybe you've heard a few things that you think we should be aware of before we start spending these funds. And maybe, well, I have a question, but I'll wait till my turn, just like everybody else. So Mark, why don't you take it away?
Thank you, Sean. Again, Mark Rich from KP Law. I've been doing town council work for quite a bit of time, and have seen a number of circumstances similar to this where monies have come through to municipalities. We did this through the MTBE more recently, and that was a different circumstance because the settlement agreements didn't pinpoint exactly what those funds were to be expended for. And at that time, DOR was comfortable with those monies going to the general fund and being expended essentially for any purpose. Whereas now, as the Attorney General has explained, the monies are subject to the specific terms of a settlement. So it's not a situation where the monies are just coming in, can be deposited into the general fund, as Deb went over quite clearly under Chapter 44, Section 53. These monies would just be general fund revenues, but they're pinpointed general fund revenues, as was explained. So we are subject to the requirements of the settlement agreement. We're subject to the requirements as the Attorney General has laid out. So these settlements reach through a number of consortium attorneys as well as the Attorney General's office. Don't come to the Commonwealth and the cities and towns without strict requirements, and that's what's made it so difficult. We're starting to see this as towns are sending us their warrants for review and are trying to figure out how to address this through various warrant articles. And the one thing we've been cautioning, and I think the DOR would agree with us on this, is a concern that has come up is some of the warrant articles have been very broad. They've simply said to raise, appropriate, transfer available funds, sum of money as is coming in through settlement funds to address opioid uses. And obviously something like that it's a nice aspiration, but it's very, very broad. And I think, as you just heard, the necessity, if you're going to actually appropriate funds, is to appropriate them for a specific purpose. So it becomes a special appropriation. It's an encumbrance, just like any of your appropriations. When you appropriate funds to buy a fire truck, that money carries forward and it remains in your special purpose appropriation until you buy that truck. So here you'd be appropriating for specific purposes. And as you heard, that could come from tax levy. Now you'll see this money coming into the general fund. It'll have to be certified out as free cash and then becomes available funds. What we've been encouraging our municipalities to do is to essentially track these funds. As you just heard, the funds go into the general fund. You can't set them aside in a special appropriation account. We've been cautioning against establishing what DOR calls sinking funds, which are generally impermissible. And that's what I was referring to earlier, putting these funds into some kind of general account just to be available for some opioid purpose. That becomes essentially a sinking fund. We don't like to use the word slush fund, but a sinking fund is essentially just a parking place for funds that are then used for general purposes, and that's not allowable. So unfortunately, most of the municipalities at this point haven't come up with a specific plan as to how to appropriate or for what purpose to appropriate these funds. So this is one of the reasons why, given the difficulty under Chapter 44, Section 53, that we've been looking hard at the recommendation, as you just heard from Deb at DOR, the use of a special stabilization fund under Chapter 40, Section 5B. And as you know, almost every town has a general stabilization fund. Some call it the rainy day fund, not to be confused with your reserve fund, but it's really we see it as a savings account that allows you to build up revenue towards certain circumstances. The general stabilization fund is to allow you to park funds for some future purpose. And then special stabilization funds, which could be created by a 2/3 vote of town meeting, would be addressing a specific purpose. So you could have capital stabilization funds in which you park monies for future expenditure on capital projects. And now we're talking about a special stabilization fund for opioid settlement funds. And one of the things that you should be aware of is the last paragraph of Chapter 40, Section 5B, that talks about the ability to dedicate funds to a special stabilization fund. So, as Deb was talking about, as would be noted in the DOR guidance, there's a mechanism to actually create one of these special stabilization funds and have the money go directly into the special stabilization fund without further action, without need for appropriation by town meeting. So you do have a mechanism to directly deposit those funds. And then, of course, you have to come back to town meeting to appropriate those funds out. So you have a 2/3 vote at town meeting to take those monies out of the dedicated fund. But the advantage here is that it allows you to save this money up. Obviously, again, and I don't need to reiterate the purposes of the expenditures, because the Attorney General very well explained that, and that information is clearly laid out in the FAQs and all the information that's on the Attorney General's website at the link that you were provided. But what this allows is for the funds to be held as opposed to a sinking fund. It's a dedicated fund. The monies will sit in that fund, and then when a purpose arises for which the town wants to appropriate the funds, town meeting by a 2/3 vote can approve that expenditure. But it protects us against a circumstance that Deb warned us about a few minutes ago, where town meeting decides they don't want to appropriate for an appropriate purpose. They appropriate for something that's not allowable, and now you've got to make sure that you ultimately make that up through some use of funds, because what you receive must be expended for the purpose that's specified in the settlement agreement. And interestingly, some of you may have already seen this. There's an email going out requiring reporting under the settlement agreement. Not only is required to report how you expended the funds, but you're actually required to report if you expend the funds for purposes that are not allowed under the settlement. So there is a specific reporting for that purpose. I hope that, that nobody winds up in that situation of reporting funds that have been appropriated for purposes not allowed under the settlement agreement. But the settlement agreement itself anticipates that kind of reporting. By using a special stabilization fund at this point until the legislature changes, hopefully changes, Chapter 44, Section 53, this would allow you to park that money and segregate it from the rest of your general fund monies, and hopefully not have it appropriated for purposes not allowed under the settlement agreement. We all know that even special stabilization funds can be changed for their purpose, but we kind of hope that there is a guarded effort to avoid that. One interesting thought, and Deb, I don't know if there's been any thought on your end on this. I know we recently saw the enactment of Chapter 44, Section 53, F and 3/4 for PEG access funds, which essentially created a new fund, unlike other revolving funds or enterprise funds. It was a special enactment to allow for cable television license fees that towns used to use kind of in a more free-flowing manner. They can now be placed in a PEG access fund and then expended for those purposes. And that again, there's a town meeting process. So it does make me wonder, Deb, if at some point the legislature would consider something similar to that as opposed to a change in 4453. That may be wishful thinking, maybe more than the legislature is looking to chew off right now, but it was a thought that we had.
What we're hoping for is a change to 4453, because it would take care of all future instances of this kind of thing. I know that this is a small town administrators meeting. I am assuming that there are last mile communities on this call as well. And there's
Yes.
going to be CAF2 funds that are going to be coming into town. So we're interested to see, how this process evolves for amending 4453, because it would be a one-time fix for all future tranches of money that come into a community. And that's generally what we would be hoping for, rather than a targeted specific fix solely for opioid funds. Although I know I had a lot of communication with the AG's office earlier this fall, and we were thinking that if we maybe tried to press the legislature to make a change, sort of tagging it to opioid funds, it would have more of a sense of urgency to it. But that didn't happen. So hopefully this time, I think this will be the third time. Hopefully third time's a charm. I think this language got caught up in the departure of the prior administration. And then, now with a new administration on board, hopefully that this will be a priority.
Yeah, and it does seem that change to 4453 would be the more appropriate. Obviously, PEG access funds, those funds continue on a year-to-year basis. Yeah. That's an ongoing. This, even though it's going to be multiple years, it will end at some point.
Right.
But having some leeway under 4453, as you indicate, that for not just this, but for other tranches that may come in the future, I think would be very useful, and it shows the kind of the evolution of the concept. We do spend a lot of time educating our clients about the limits under 4453 and how to use free cash and also discussing stabilization funds. But a little bit of leeway, given these unique circumstances within 4453, would give cities and towns a better and a clearer avenue to address this. But again, and I think you covered this as well, the special stabilization fund right now the idea is gaining some traction, because again, it allows for a comfortable and appropriate parking of the funds.
Exactly.
And especially if it's the dedicated fund into which the funds go in automatically, just avoids, because again, what we've been discussing with our clients is kind of an offhand, a sidebar tracking of the funds as they progress through the general fund and get certified out as free cash. That does require just a pencil notations on an ongoing basis. And the concern, of course, is as this goes through multiple years with changes of personnel, whether that's going to become problematic, and then Deb, that becomes your headache.
Yeah,
So-
exactly. And I had this very conversation yesterday in an email with the community. And I use the example, you got 30,000 of opioid funds, that was certified as part of your free cash, but you only spent 10 this year. You have to remember that you carried over 20, but then you got another 20. So, I mean, it is very complicated. And we feel it as much as the communities and would like nothing more than to see the funds be able to be used for their intended purpose more easily.
That's great, because I actually have had that exact same conversation just a couple of days ago, and use the same example. If you got, and I try to use the smallest numbers. If you got $100 and you only spend 50, you're carrying that 50 over, then you get more, and it balloons. And
Yeah.
so those notations, and a lot of town accountants and the collector treasurers, they work together, and they're very good at tracking these in municipalities. But it's easy to get lost, and again, these monies come in at odd times, and just keeping track. And we're using small round numbers, but these won't be as
Right.
small or as round, and so it'll complicate your bookkeeping.
And, you pointed out, turnover in employees. What we're seeing across the Commonwealth, and especially in the smaller communities, is there is an abundance of turnover in staff. And so maintaining those records is a challenge that I can see would be an issue potentially. So, but, to the Attorney General's office, one thing that we stress consistently is that despite the procedure that has to happen, closing the revenues to the general fund and then being appropriated out, if a dedication of revenue doesn't happen to the stabilization fund, it does not absolve of the responsibility to use the funds for their intended purpose.
And yeah, we've given
So
actually that exact same advice, reminding folks that if you got that $100 and you wound up in your free cash expending all the money for everything other than that purpose, you owe $100.
Exactly.
So let's, that was a great back and forth discussion, by the way, and it was surrounding a question I was going to ask, the difference between that special revenue fund that DOR is supporting in the legislature versus, well, at town meeting, we can create a stabilization fund. So I think you really fleshed that out well for us. I think a question we'd like to know, maybe our Legislative Affairs Committee would like to know, is where is this amendment and who can STAM or our membership contact to maybe support that language?
I can get you that information, Sean. I know Sean Cronin sent us an email the other day indicating the vehicle that he thought it was in at this point. But we would love nothing more than to see the MMA, STAM, and other municipal organizations sort of lobby for that legislative language change.
Very good. Okay. Well, when we get that information, we'll share it with our membership and our
Sure.
Legislative Affairs Committee as well. So thank you. So I'm going to pull the old host and ask the first question, give myself, I reserve that right. I'm not clear on this, and I'm wondering, do we have two sets of reporting? We got to report what we were just talking about financially through DOR intended purposes, but maybe this is to Sandy or any one of you three. Aren't some of the settlements, do we have to report separately to the court? Is that part of the pharmacy settlements, or am I misreading that?
Municipalities don't have to report directly to the courts, but there are a couple of different reporting mechanisms here. So what I described in my presentation is reporting to the Executive Office of Health and Human Services. This is annual reporting that is currently still in draft form. We don't have a final report template yet, but it's going to start this summer. It's going to apply to municipalities who receive $35,000 or more in the fiscal year, either for themselves or as part of a pooled collaborative. And that's going to be questions about the uses of the funds, and the input of community members and in shaping how those funds are used. I can drop the link in the chat to the draft report that we've put together. In his remarks, Mark pointed to another kind of reporting that we hope does not apply to anyone. This is not reporting to the court, but it's reporting directly to the national settlement administrators. And they do reach out directly to the state for purposes of the statewide ORF funds and directly to cities and towns who are receiving funds under the settlement to ask for reporting on any expenditures that do not fall within the approved uses under the settlement. So it's not court reporting, it's to the settlement administrator. I'm hopeful that we all across the state are not going to have any such reports made, but you may have recently received from our settlement administrator information about the non-abatement opioid settlement fund uses. So that is kind of yet another potential layer of reporting, but one that we hope is not relevant.
Yeah, thank you, Sandy. That's exactly what I was referencing, and one that I have cautioned a number of municipalities about. It seems like the you'd be outing yourself, and you would hope that you would not be in a position to do that. That's clearly not the intent of the settlement. The intent of the settlement, as we've all discussed, is to dedicate these funds to the opioid crisis, and this most recent communication, it should make people nervous if they have to use that reporting mechanism, because that's reporting essentially a misuse of those funds.
Well, reminder to folks, you can use the Q&A for your questions. Denise, did they cover the questions we had in the Q&A, or was there more?
No, I'll elaborate a little bit for Sandra. You did touch upon it, but if towns are pooling their settlement funds, so let's say 5 towns got $8,000 each, so collectively they exceed the $35,000 thresholds. Do they need to report on that, or no, because each individual community received less than the $35,000?
Yeah, it's a great question. So yes, if you reach the $35,000 threshold through pooling, then every member of that pool needs to submit a report. But you'll see if you take a look at the draft report and when the final comes out, that it's contemplated that you may be part of a collaborative and that the questions will make sense, sort of asking about the funds specific to your municipality that were expended for particular uses. So yes, if you reach the threshold through pooling, every participant should plan to report.
Thank you.
Excellent. We also had, Mark, you'll like this, I'm sure. A couple of questions, or maybe they were snuck in the chat. Folks want you to draft a warrant article for all of us, free of charge, as to how we will, it didn't say that in the chat, but.
But you said that.
Yeah, no, it was asked if KP Law would be putting out a sample as to a warrant article for that special purpose stabilization fund until such time as the legislation may pass.
And Sean, to that question, we do have a warrant article that probably can be used by everyone. The way we've drafted it is to both create the special stabilization fund and accept the portion of the statute, because this is a local acceptance provision within that statutory provision that would allow for the dedication of the funds, so that the funds can go directly into the special stabilization fund, as we discussed. And we also included a provision to allow for an appropriation into that fund, or transfer into that fund, of the funds that have already been received. So to the extent that towns have funds that are available but have not yet been expended, they could be transferred depending on when they act on this. But some of the towns have monies from prior settlements already sitting in their free cash and have not yet been used.
So that, as you were answering that, I was reading a question from Carl out of Clarksburg. So does that mean once it's set up, we get revenue in? It does it have to go through town meeting, a separate appropriation every year? We're getting a new.
No, No, I think that's what Deb was saying as well.
Yeah,
That the monies that if you simply create a special stabilization fund like your capital stabilization fund, you would then have to transfer money into that fund whenever you chose at a town meeting. The purpose of accepting that last provision of the statute is to allow the monies to go directly into that fund without further action from town meeting. So as we're talking about, that avoids that situation where the money just goes into the stabilization, into the general fund, becomes certified free cash and somehow gets lost within the free cash, or not tracked to enough of a standard. And you want to with a situation where town meeting may inadvertently appropriate those funds, and as we're talking about, you would owe those funds going forward. This kind of avoids that circumstance by allowing that money to flow directly into this special purpose stabilization fund.
So as a follow-up to that, once the funds are in this special purpose stabilization account, it still requires a 2/3 majority of town meeting to appropriate out.
Yes, yes.
And so it was
Yeah,
mentioned that it could be town meeting might appropriate it for an unintended purpose or something other than what the fund allows. How do we deal with that if, say, town meeting continues to vote down utilizing these funds? Is there a way around that?
Well, absent a change in the legislation, as we're talking about, the beauty of the special stabilization fund is it kind of protects against that situation and the bad consequences. So, the towns, as they develop their warrant articles for the appropriations out of the special stabilization fund, yeah, there's the possibility that they could be voted down, but the money is essentially shielded. It would take a significant effort for the towns to be able to use them for other purposes, changing the purpose of the stabilization fund. So even though they'd be voted down, they'd still sit in that fund until eventually, hopefully, you hit the sweet spot where town meeting approves it. But the monies are protected from other uses, and so you don't have that situation where you owe it based upon failure to have accounted for it in a prior year. So yeah, it's at some point, obviously, we are beholden to town meeting. So much like any other stabilization fund, there's a 2/3 vote to take that money out. But at least in this instance, there is some protection of those funds.
Great, thank you.
so
No, Deb is eager to speak.
I just
have a-
wanted to point
Go
out
ahead.
that IGR 1720 does include sample language in it for dedication of the revenue vote. And the other thing I just wanted to clarify in case it got lost is without the dedication vote, it's the dedication of the vote to dedicate the revenue not less than 25%. That allows the automatic transfer of the opioid funds into the stabilization fund. Without that, you can't vote directly from the opioid funds a deposit into stabilization. It does have to go through the free cash process first.
Right, exactly. That's
Just a little nuance there that I just wanted to make sure everybody caught.
Yeah, that was the reference to the
Yeah.
local acceptance of that last
Exactly.
paragraph of the statute. Exactly right, because otherwise the money just, again, would go into your general fund, you'd be certified out as free cash, and then could be transferred into a stabilization fund. This avoids that step, but it requires that acceptance, and that would be incorporated. So you'd have your warrant article would have a couple of different steps. It would create the special stabilization fund. It would accept the statute for the purpose of dedication of at least 25%. And then if necessary, transfer into that fund any existing monies that the town would want to place into that fund.
Yep.
Thank
So-
you. There was, I was going to say, we have about 2 minutes left. Denise, did you have a follow-up?
I was going to sort of take the new question that came in. And so if an appropriation is made to spend out of the special stabilization fund, and number one, all those funds are then not used in the following fiscal year, does that then roll back into the fund, or will that then roll to free cash?
No, that should automatically close back from whence it came, is the way we say that. Even if you were voting from stabilization for a capital project and you did not expend the entirety of that appropriation, it can just close back to the stabilization fund.
Okay,
Right.
so folks that are looking to not, so folks that are putting plans in place that doesn't have sort of one big item can still appropriate out a dollar amount that would cover all of their little items. And then anything left would go back into the fund to be reappropriated out at the end of that fiscal year.
Correct.
Correct.
They don't need to come up with a revolving account or some other mechanism to try and utilize these.
No,
No,
there's
a
no revolving.
a revolving fund is not appropriate for these funds.
Correct.
Although
Correct.
on the surface, when you talk about revolving funds, it sounds like it should be, but it's not.
Right. That's why you had that discussion about the PEG, which was a
Yeah.
bit of tangential, but yeah, there's no revolving fund that would quite fit this concept.
I have, we're going to close now. We're at just at 55 minutes, but we did not talk about ideas and things that cities and towns are doing with the funds. Maybe that's a future meeting. I'm wondering if there'll be a clearinghouse for best practices. I don't know if the AG's office or HHS would lead that, if we're going to be reporting to them. Is there any final word on that, Sandy?
So we are actually hosting, co-hosting with DPH a webinar next week where we will be getting into some best practices, I think particularly around pooling funds with sister cities and towns, and also community engagement strategies. And we'll have our expert friends from DPH on the line to talk about kind of the public health lens with which we're approaching the approved uses and the sort of the goals for this abatement money. So I'll put that info in the chat now. The webinar is going to be next Tuesday at 3 p.m. And I'd encourage anyone who's interested in continuing this conversation to join us next week.
And Sean,
Thank you.
so towns might be mindful of just paying attention to Chapter 40, Section 4A, intermunicipal agreements for shared services. That might be something useful as they embark on shared services. And intermunicipal agreements can be entered into through the executive offices, so the select boards can agree to that. That's no longer a matter that has to go to the town meeting.
That's great. What a great way to end this conversation today. And Mark, the statutes just roll off your tongue. 40, 44A, 50, 53. It's impressive, I must say. So I want to
I think Deb and Sandy have that same affliction.
They certainly do. But I want to just give a final thank you, Sandy, Sandra Walitsky from the Attorney General's office. Thank you so much. Deb Wagner, it was so nice of you to take time to join us, Mark. And we ended up with well over 50 people on this call, so it's obviously a topic of interest. So look forward, mark the calendars for June 12th, Denise. STAM annual meeting. I hope I got the date right. No, that's our annual
June
meeting.
15th.
June 15th. Ethol's annual town meeting is June 12th. Yes, June 15th for the STAM annual meeting. We'll have some great guests and a great program coming together. Denise under the program committee. And thank you all for joining us today. And I hope to see you again soon. Take care, everybody.
Thank you, everybody.
Thank you so much.
Thanks, Sean. Thanks, everyone.
Thank you.